welcome back to We Are Austin. For this edition of Medical Monday, we are talking about men's health and prostate cancer. Specifically, Dr. Simon Trubek with ARA Diagnostic Imaging shares the latest information about nuclear medicine, which you may have heard of, and how it's used for early detection, which is super important. Good morning. It's great to see you.
Good morning. Thanks for having me back.
Oh, it's my pleasure. I think this is very, very important to talk about. So right off the bat, let's kind of explain what is nuclear medicine, because our viewers may have heard this term.
Sure. Nuclear medicine is just another type of imaging that we perform at ARA, and unlike a CAT scan or ultrasound or MRI, the big difference is that we actually inject the radio tracer into the patient or have them swallow it or breathe it, depending on how we want to study the patients and which organ we want to study. And then we put the patient in the machine, and then the x-rays that come out of this radio tracer we capture, and we can talk about the anatomy of the organ and more importantly how it functions.
Oh, wow, that's fascinating. So you touched on it a little bit there. You inject or place. So how exactly does the process work so the viewer at home kind of has an idea?
Sure. So PET-CT is one of the different types of nuclear medicine, kind of the subset. So with PET-CT, we actually inject the radiopharmaceutical into the patient's vein. Then we wait a little bit, and then we put the patient in a machine that looks like a CAT scan machine, like any other machine. And they spend some time in that machine, depending on what we're doing, what we're studying, probably 30 minutes, and then it's done. And this is what it looks like.
So this is kind of an idea of what the patient can expect.
Yeah, it's, you know, all the differences on the inside and how this study is performed.
That's fascinating, and it's really, as we spoke about, it's new technologies being developed all the time, but there's a really cutting-edge process that's out right now, correct?
Right, and this radio tracer is called Axumin, and this radiopharmaceutical identifies prostate cancer specifically. So wherever it may be, we inject it in the vein, and it finds those small cells or potential very early recurrence. What we look for with this very early on, so we can intervene.
So this is kind of how that works, right?
Right. So this is a general view, and you can see, for instance, this area just literally lights up.
It's lit up, yeah. That's fascinating.
So when we're looking for an early recurrence, so we can intervene and really improve the life expectancy and life quality of the patient, we find it much earlier. So here's a good example.
This is fascinating to me.
Yeah, this is fantastic. So here is where the cancer is, right there, and it's really hard to identify.
Very difficult to see, yeah.
But with this new tracer, it just literally lights up.
It's lit up. It's like a beacon. It's like here it is. And so that's really what's important, because we're talking about early detection. And how does that help the patient, obviously, in terms of treatment?
So in terms of treatment and life experience, it's fantastic. So when we identify a recurrence very early on, we can target that recurrence and get rid of the disease early on, instead of having to wait to identify and document that recurrence and subject the patient to really rigorous, significant types of treatment. So
that's really amazing. This is cutting-edge stuff here, and you're doing this currently at ARA Diagnostic Imaging. And if people want to know a little bit more about this probably sounds like something that might, especially right now, we're talking about men's health specifically, prostate cancer. If this sounds like something you or somebody you know or love or someone in your family should take advantage of, ARA has 17 locations throughout Central Texas, so very likely somebody's very close to you, right?
Right, absolutely.
You can go to OzRad.com to get a little bit more information. I think that's important stuff. Thank you so much for sharing this with us.
Thanks for having us.
And take advice from ARA, and early detection is what saves lives.
Thank you.
Appreciate you.